This is a video on depression. Depression is the most prevalent mood disorder. Depression can be defined as a psychiatric condition characterized by symptoms like unhappy mood, loss of interests, loss of energy and appetite, and difficulty concentrating. Most of us do experience these symptoms at some time, but for some people, this is not a passing malaise. This condition is most common in people over 40 years of age and more common in women. According to government surveys, more than 7% of the population will experience clinically significant depression. There are changes that occur in the brain during a depressive episode. This includes the dopamine hypothesis and the serotonin hypothesis. In the dopamine hypothesis, it is believed that decreased levels of dopamine cause depression in some individuals. Dopamine is an important neurotransmitter involved in the reward system of the brain. It is released in the synapse and is broken down by monoamine oxidase, or MAO. Medications that prevent MAO from working are called MAO inhibitors. If you slow the breakdown of dopamine, then dopamine can work longer in the synapse. The effect is like adding more dopamine to the synapse. The MAO inhibitors were the first antidepressant medications to be used clinically, and they worked wonders in a select group of patients. Their mood lifted, and they were able to get back to living independently again. This was a big breakthrough and the beginning of the dopamine hypothesis. MAO inhibitors, however, did not work for everyone. The medication was also very difficult to take due to the unwanted side effects. Attention was turned to serotonin, the other neurotransmitter involved in the reward system. Serotonin is released into the synapse and is not broken down there. It uses a reuptake system as its primary method of removal. If you inhibit the reuptake system, then the serotonin will remain in the synapse longer, with the same effect as if there was more serotonin. This promoted the serotonin hypothesis, that depression is caused by decreased levels of serotonin. Medications that slow down the reuptake system are called selective serotonin reuptake inhibitors, or SSRIs. These medications include Prozac, Paxil, and Zoloft. These medications also worked wonders on a select group of patients, but not all. Neither the dopamine hypothesis nor the serotonin hypothesis is the correct answer for all depressive patients, so there must be more to it. For people who do not respond to medications, there are limited options. One option is electroconvulsive therapy. This is where a seizure is induced in the patient by passing a strong electrical current through the head. It is felt that this is like pushing the reset button on a computer. It reduces the connectivity of the overactive prefrontal cortex. A series of seizures are induced over a period of a few weeks for the patient who is severely clinically depressed and refractory to medication. This does improve the condition of the patient, and many can return to independent living. Electrical stimulation can be applied continuously through an implantable device called a vagal nerve stimulator. This is placed on the vagus nerve and sends small pulses of electric current intermittently through the vagus nerve to the brain. This has also been found to help with depression. Finally, a deep brain stimulator can be placed to send an electrical current directly to the brain, but where to place this stimulator and how effective DBS treatment is remains a controversy. This ends the video on depression.